have the greatest job in the world, and that's working with dogs.
Best in Show winner is the French Bulldog.
Winston won the National Dog Show. It was amazing. It was exciting. And to have a dog to be #1 dog in this country, you have to have great nutrition. And I always fed Pro Plan. Just like us, when we eat well, we feel good. And I just love that food and what it's done all these years to all the dogs I've bred and all the dogs I've shown.
All right, you guys, welcome to Pure Dog Talk. I am your host, Laura Reeves, and I have a super special guest today. Dr. Karen Potter is a really good friend of mine. She's a German Wirehair Pointer and Vizsla breeder. And she and I have had an ongoing conversation about a lot of things, but particularly about PENN hip evaluations of our dog's hip x-rays. And as I was telling Karen earlier, I'm like, we've never really talked about this. You know, I've had Eddie on to talk about OFA, and we've done a lot of things with that, but the concept of the PENN hip program, how it started, why it's useful, all of that, we've never really deep dived on that. So Karen is here to talk to us about it. We were just talking. She is from Michigan. She is from a tiny spot in Michigan where there's one stoplight in the whole county, which I had to get that into the show. I love it. So welcome, Karen. How you doing?
No, I'm doing great.
Awesome. So talk to me about, you're a veterinarian. You're also a dog breeder. What is it about the PENN hip program that made you say, you know what, this is how I want to evaluate my dog's structural hip, breeding potential, all that?
Yeah, so let's start out with the fact that while yes, I do PENN hip my dogs, I typically will go back and still get an OFA score on them. So I have both avenues to look at as I'm going through my breeding. With PENN hip, we're able to have a number that I can use, a laxity score, what they call, in order to then go forward with breeding. And that gives me an idea of better off of if I have a dog with a higher laxity score, to then breed that to a dog with a lower laxity score to try to continue to bring the number down in the offspring, trying to improve the hip quality. The PENN hip program, so PENN hip, most people don't know.
Right, so I'm like, okay, so let's go back to the basics. Tell us what, for those who don't know, OFA and the OFA x-rays and PENN hip specifically developed by the University of Pennsylvania, right?
So it's called the Pennsylvania Hip Improvement Program. Okay. That's what it stands for. Okay. And yes, there was a veterinarian at Pennsylvania where this all was established. It's now
Penn State, not UPenn.
Yeah. And now Antec, the company Antec, who the radiologists are through.
Okay.
So what the PENN hip program has done is they determined that the laxity score, which is how much the hip joint is able to luxate during movement, so during each step. And that laxity, so we all know the hip is a ball and socket joint, and the laxity being how much the ball can come out of the socket. Okay. And so when that ball comes out of the socket in each step, they've found that those forces and each concussive force is what we then develop osteoarthritis from. Okay. So when we're looking at a PENN hip score, we're looking for a score that is smaller. Lower numbers are better. Right. So it's a distraction value saying this is how much we can passively distract the hip from the socket. And I say passively because we're doing this while the dogs are under heavy sedation or anesthesia. And so what we're finding is first we get a measurement of the hips in the socket, and then they compare that to the hips that are done with a distractor. The distractor scares everybody. Okay.
We have show and tell. So for those of you who are not watching on YouTube, go watch on YouTube. This is the instrument that's used in the x-rays to show the distraction of the hip joint. Am I getting that right?
Yes. And so I believe there's a lot of misunderstanding about how this is used. So let's go through the PENN hip process. First thing is extended VD film exactly like your OFA film. And the reason why they do that is because they're checking for ongoing osteoarthritis. So they're looking at that film to make sure there's no evidence of arthritis starting already.
So you're
Okay.
looking at the ball in the socket, right? Like, is
Yep.
the socket shallow? Is the ball properly formed?
Or
So
yeah,
that's
exactly.
part of the overall view that the pin hip vets look at.
Correct. And then we do what's called a compression view, which at that point, what we're doing, the dog is still laying on their back, and we take their hip joint and we push the ball into the socket.
Mhm.
That gives the pen hip veterinarians the baseline to then measure the distraction off of. If you want to see the complicated formula they do that by, it's on the pen hip website. It's math.
And so, but the important thing is the veterinarians who do pin hip x-rays like yourself have to have special training. This isn't just
Correct.
any old Joe Blow vet down the street. Farmer Joe in the farm clinic can't do this. This has to be
Correct.
people who are specially trained how to do these x-rays.
Yes, you must be pen hip certified in order to do x-rays. So then when you go through your pen hip certification, you buy the distractor. And what this is a couple of different, there's two rods in there that are covered by foam. And when people hear the word distractor, they think that this thing is being used to push the hip out of the socket. It's not doing that at all. All that is being done is one of my technicians is holding that distractor just where the pelvis is while the dog is still on their back. I bring the legs up into a standing position, and the femurs are actually pushing on those bars. So it's acting as a fulcrum. So I'm pushing on the bars with the femurs, which then will pop out the distraction index. So that's what moves the hip out that they can measure.
Interesting. Okay, I don't know
Yeah.
that. I'm saying, like, I had my first dog pen hipped in 1990. I don't even want to discuss. Maybe five. Very early in the process, to the point that there were not enough German Wirehair pointers to have her compared to. Right, she had to be compared to the
Yep.
general whatever. So that is an interesting piece of information. Talk to us too about the history of how this has developed over the last, really, it's been about 30 years, right?
Yeah, I believe it was in the 80s when it really got started in development. And so what has happened is a couple of different things to note about pen hip also is if I do a pen hip study, I am required to submit that to ANTAC
Right.
as a pen hip veterinarian. We all know people who have done an OFA film and gone, oh, well, it's not going to pass. Why submit it? Right. So are some of our OFA stats skewed some because of that? Yeah, possibly they are. As a pen hip veterinarian, I submit every pen hip series I take. The other thing is, as a pen hip veterinarian, if you ask one of your pen hip veterinarians, what's it going to score? I'm going to look at you and go, I don't know. It's math, right? So I won't even take a guess. And the other reason why I'm not going to take a guess is because I'm typically going to get results in 3 business days. So as long as I submit that, I'm going to get results for you super fast.
So here's, Karen, stop just for half a second, because I think this is another, like, super important piece. And this is no disrespect to OFA by any stretch of any imagination.
Absolutely.
Okay. OFA is what we call subjective. It is 3 people's opinion of what those hip x-rays say. And the people who advocate really strongly for pen hip, yourself included, it is objective. It is math. There's no opinion. There's no personal bias. It's just numbers.
It's just numbers. They're going to spit out a number. Also on the report, it's going to say whether or not they see any osteoarthritis in there. So it's something to make note of. But they're going to give me numbers. They're concrete numbers that I can look at. Something other to remember about pen hip is that you can get this laxity score down to a puppy of 16 weeks of age.
Yes.
I have not done personally any dogs of that age. I have done, we were sending one of our dogs out to field trial. She was about 7 months old when I did her hips to make sure that before we sent her out, that I was sending out good solid hips before we sent her out with the trainer.
But I think, Karen, that's a super important point. And I want to talk about that from 2 perspectives. Number one, as a breeder at, 4 or 5 months old, we can make a decision about whether this dog stays in the breeding program.
Correct.
Number 2, address the question. So, like the devil's advocate of they're babies, they're made out of freaking, Gumby and chewing gum at that point.
Right.
How is it accurate in a baby puppy like that? So, speak to those two pieces if you could.
Yeah, so I wondered that also, and there's a bunch of studies to show why PennHip was able to say yes, this is distraction index is the same on these dogs when they're 16 weeks old as what they are 2 years old. So they have done the studies to show that through the lifetime of the dog, the distraction index maintains within a statistical range that is accepted. Again, those are the people that are way smarter than I am that do those studies, but the studies have been done. Otherwise,
So
they
you'll
would have
send
proved
that
it.
to me and I'll drop a link so that
Yep.
people who actually really want to get super
Yeah,
nerded out about it can do that.
absolutely. And so then when it gets down to it, I personally do my own dogs around a year of age. The reason why I do that is because that is where our canine health information center, our chick standards drew the line in the German Whitehair Pointer is 1 year. And so you can pretty much guarantee any of my dogs in my house at 1 year of age, they're on my table because I'm like that.
Well, but it's important, right?
It
Like
is.
we live in a society, we cannot just keep every dog. We cannot have
Exactly.
100 dogs in our house.
And
For
and
those
I
of us
want that
who,
information.
right, and for those of us who breed dogs, like I can't keep this bitch until 2 and then find out it's terrible, right? Like I
Exactly.
could pet that out at a year, bada bing, bada boom.
And they can go be spoiled as an only dog at that age rather than waiting until they're 2 years old to find out. Now, at 2 years of age, I go back and I get OFA views on my dogs. So I have that information also. There's one dog in my house who will come up later that I don't have an OFA view on. It was just a personal choice. But everybody else I go back to have both. So I have both to look at when I'm breeding.
Okay, so here's a quick question because we've got a whole case study. We've got tons of stuff to get into on this topic. But speak to me about your personal experience. You've now got multiple generations you've done this with.
Mm-hmm.
Personal experience of PennHip, distraction index, and when they give you the report, they kind of give you a falls in the breeding, you should breed this, you should not breed that, versus OFA, the fair and up that says it's not dysplastic, and the whatever it is below that that says it is dysplastic. Compare for us what is an OFA fair and I don't know, PennHip somewhere in the 30s. How do those compare?
So that's where it becomes very interesting when you do both, is that you
Right.
will find
That's why
some
I'm
dogs that can
asking.
hit very well that then come back OFA fair. And I'm standing there looking at it going, but I have a really good pen hip score. But I think this is again where we start thinking about, well, let's look at both, because OFA is they're looking more at the socket and the socket formation and how much acetabular coverage there is, acetabulum being the socket.
Right.
And they're not looking necessarily at that laxity unless there's subluxation on the OFA film on the extended VD. And that subluxation doesn't always show up on the extended view because there's windup of the muscles that tighten that hip back into place when we extend those legs out. And so those dogs that may sometimes have a big subluxation or a big distraction index may not show the subluxation on the OFA view because of the windup of the muscles and everything. So it sucks it back into the ball. So you're going to have some discrepancies. The majority of the dogs that I've done both on, everything is fit. Like a good pen hip has been an OFA good.
Right.
Yeah, everything. But I did have one just recently that had a very nice pen hip score that came back OFA fair. And it's just a matter of going, okay, well, how do we go forward with this? I'm not going to necessarily kick a dog like that out of a breeding program, but I'm going to breed that very smartly. I'm going to be looking for another dog that has pen hip and maybe even try to go a little tighter. Maybe find a dog that has pen hip and OFA and look for an OFA excellent dog. So I know that the acetabulum formation is maybe a little deeper to try to compensate for that. But I have a number at least on that dog to then consider where to go from here. And can I go tighter?
Trupanion is revolutionizing medical insurance for pets by providing the best possible experience to our members. And it's not some space-age dream. It's happening now. We pay your veterinarian directly while you're checking out, and we're the only ones who can, which means you have decisions in seconds, and you don't have to wait for reimbursement. So unlike with other providers, you'll keep more money in your pocket. Ask your veterinarian if Trupanion can pay them directly, because there's pet insurance, and then there's Trupanion.
Talk to us about the numbers. You're talking tighter. So I really want to kind of deep dive a little bit on this one. The numbers for what that, they call it DI, what that distraction index is, it's different per hip frequently.
Yes. And so you're going to get a report.
Give us that, like, from 0.19 on up to 0.5, right? Like, talk to us about that.
So the report comes back to you, and it has your right DI and your left DI. And often they are a little different. That's not a big deal. Dog by dog, right? The other thing that's going to have is a graph of your breed. This graph is going to show the 90% range of your breed, meaning, again, I have show and tell here.
Here we go, show and tell on YouTube.
Woo! So this is the graph of the German White-haired Pointer. I know you guys can't read that very well, but that gray box is showing where 90% of the German White-haired Pointers have been, okay, when they're hip views. This black box, which on the German White-haired Pointer sits at 0.37. So, find my camera here.
Right.
So there's a little black box in that gray box. That is showing the breed average. Right now, I think we were just talking
0.37? Really? Wow.
Yeah.
Okay, that's interesting.
So we were talking before we started that the German White-haired Pointers have over 750 dogs in the database now. And so now they're getting these average off of all of those dogs that have been submitted as German White-haired Pointers. So when you look at that, 90% of them land in the big gray box. The average is the little black box. Now, your dog
super
is
interesting.
Going to be this one over here.
Right, is that one over there. And so that's tighter. So it's better than the average and the vast majority.
So this dog sits in the top 5 percentiles of the tightest hips in our breed. Okay. So now there's going to be some dogs that land out here that are going to be in the looser 5%. Okay. And so with that, then what we're trying to do is always trying to shift that graph to the left.
Yeah.
So of course, the paper I picked up to show you is a dog that I'm not shifting that one much further to the left.
Yeah, can't go much further. But okay, so there's a couple things with this then. So there's two things that come to me right away. Number one, that bitch that I x-rayed in 1990 whatever, right, is one of those 750 dogs. Even though at the time she was not compared to other wire-haired pointers, she was compared to the whole group. And one of the benefits, I believe, that can be stated of PENN hip, and that I know people ascribe to, is that your dog's hips are compared to your breed. So a German wire-haired, just a perfect example, a German wire-haired pointer and a Spinoni Italiano, two continental versatile hunting dogs with beards. Their hip indexes are not the same.
They're very different. And I don't have...
Not the same.
Not at all. And I cannot... Actually, I have one of the old breed averages here, and I could look up what Spinoni was.
I'd be curious.
Is a couple of years
right, because
outdated.
They're not going to be the same.
No. So when I printed this off, the average in the Spinoni was a 0.48.
Right. And the average for a wire-haired pointer is 0.37. Right.
Correct.
So Spinoni as a breed have looser, more lax hips than German wire-haired pointers. And so instead of comparing your Spinoni to a wire hair, you're comparing your Spinoni to another Spinoni.
And when you get that number, so say you have a Spinoni that comes out as a 0.3, yay, way cool, way below breed average.
Right.
Okay, well, now I know if I can also breed that to another dog that's below breed average, I'm potentially going to produce a whole generation of dogs below breed average,
Right.
which is amazing to be able to look at those numbers and be able to do that. So let's finish up on the graph here.
Yeah.
On the graph, it breaks your risk categories into 4 risk categories. So low risk is from 0.3 and lower. They consider that low to no risk of developing osteoarthritis. From 0.3 to 0.5 is mild risk. 0.5 to I believe it's 0.7, moderate risk. 0.7 up to 1 is high risk. So they're going to put you in that category to say, here's what we feel your risk factor of osteoarthritis, so development of changes in the hip later on in life. So when you get that number, when you're looking at your dog's future, if I get a dog in the moderate risk, I need to be a little more careful. Okay. So maybe minimizing some of the jumping, maybe looking at earlier practices with glucosamine and products like that to try to help them along. Whereas when I look at my dogs on low risk, I'm like, well, I'm in pretty good shape. I'm not too concerned about what their hips are going to do in their futures. And so that's where it's kind of nice to have those risk categories too, which again, they've studied those to develop those risk categories with following dogs along through studies. So that's the graph that you're going to get. And in that, it will always give you the breed average, the breed 90 percentile. So then you can look at it. And the concept of breeding in PENN hip is to breed below the breed average. Okay. Does that mean that every dog above the breed average shouldn't be bred? Absolutely not. Okay. Because we know that breeding is an art, not a science. Let's start there. I mean,
both. It's both. I'm just saying.
yeah, it's both. But in the fact that there's only so much we can do. But yes, we're going to look at that as a component and decide what to do with that number. And if I have a dog that's above the breed average, I'm going to be looking for another dog that's also PENN hipped and well below the breed average to start bringing that number down. Because if I then bred that dog with only an OFA score, and the dog may be OFA good, but I don't have a laxity score,
right?
I don't know what that is. And I don't know if I'm going to improve the next generation. Whereas if I breed to another dog with PENN hip, I can make a little bit of a guess on that.
So the important thing we have is your case study, which I really want to get to. Is there more that we need to clear up on this before we get to the case study? Because I just think this is fascinating.
I think we're good.
Okay.
I think, the concept of PENN hip, it's very interesting. And it's one of those that until you really sit down to look at it, it's difficult to understand. And I know that, and that's why we try to explain it.
Right. That's why I thought this was such a cool thing. And I got the idea to talk to you because you had posted something about this particular situation on your social media. And I'm like, oh my God, we have to talk about this. Because I think there are misunderstandings. There's a lot of people like me that tried it once back in the 90s and are like, this is a pain in the ass, costs a lot of money. Like, why am I doing this?
Yeah.
Right? So the why am I doing this is what this case study that you've done on your own dogs for, is it 3 generations now?
No, I've got the parents and the offspring.
Okay.
And then I have another pup out of second litter.
Okay.
Yeah. So I'll start out, and I'm pretty open about all this stuff. One thing we didn't hit on is the fact that anytime that you want your PENN hip numbers to be of public record, if you send them to OFA, they will put them on your dog's OFA record. Okay. So I know that's been an issue with some people is they want it to be able to be public. It can be. So I have a stud dog and a dam that I bred together. And these dogs were both dogs that I did PENN hip on when
there's a fly.
When I just started training in PENN hip. And so Bonzo was my male dog, and I PENN hipped him at 8.5 years of age, which is also the very fascinating thing to know that the score should stay the same throughout the lifetime.
Right.
And his numbers came out, both of them the same. He was a 0.33 on both left and right. Well, I have a female named Sasha who I also did the Penn hip. That was the chart that I had shown up there. And she's a 0.16, 0.15. Now, from
That
here
is
on
crazy.
out,
Like the lowest score I've ever seen is a 0.19 in wire hairs. I mean, that's insane.
okay, especially being that it was very early in my Penn hip, I took so many x-rays of this dog because I was like, I'm not doing
This can't be
something
right.
I can't. I don't see the distraction. And I submitted like every film I had to them. And so they do like that because then they go, well, no, you're doing everything right. There's a bunch of things we have to look at on the film to make sure we're doing it right. Besides the point. But I was like seeing all those things, but I'm like, I can't see the distraction on the dog. Well, it's because it is that
It
small.
wasn't distracting.
Yeah. And she is the one dog I don't have OFA on. With as tight of hips as what she had, I just never went back and put her on the table for the OFA hips. When we talk about Penn hip, what we're going to do is use the highest number as what the dog's score is. Okay. Yeah, there's going to be two different scores, but we're going to base our decisions off of the highest number. I bred Bonza and Sasha together, and I am fortunate to have results of 6 out of 7 puppies with Penn hip results. And I have all of them here, and I will tell you every single puppy lands between their mother and their father. So with Bonza being a 0.33, I was able to bring the offspring number down. So the numbers on these pups, 0.2, 0.22, 0.27, 0.2,
really
0.19.
Good places
They're all
for a wire hair.
They're all in the low to no risk.
Wire hair is good.
But the very fascinating part is the fact that they are all right between their parents.
Yeah.
Now, I bred Sasha one more time to another male that had a higher Penn hip score. His Penn hip score was 0.38. Okay, so Bonzo was 0.33. This one was 0.38. She only had 2 puppies, so I have Penn hip score on one of them. And this one did come out a hair higher than the rest of the other litter. It makes sense. She's a 0.29. Still a very good Penn hip score.
Yeah.
Because I knew that with Sasha being as tight as what she is, I could use that dog that at the time was at average. The average has changed a little bit in the last couple of years.
And
when I did his Penn
we
hip,
need to talk about that when you finish your case study.
Yeah. And so he was at average when I did that. But I expected that puppy that I did out of that litter to be just a hair higher than the other litter because I used a stud dog with a number that was hair higher. But she's still in the low to no risk category. She's still where I know that I have a really high quality hip. So that's where I think trying to understand the Penn hip numbers and knowing that we can make differences in the offspring is so important going forward. Now, you breed 2 dogs together with very similar Penn hips, you're going to get dogs with about the same numbers. Okay, that's great, especially because you know the numbers. But it gets back to that dog that is above breed average. Does a dog above breed average take them out of the gene pool? No, because I just breed them smart. It gives me more information of where to go. A dog like Sasha with a 0.16, 0.15, if I want to breed her to something OFA only, I'm like, heck yeah, bring it on, because I know that whatever I breed her to, she's going to bring that number down. And so that's where it's nice.
So, okay, so here's a couple places I wanted, because I wanted to get that case study because I thought that was really useful. Because it was actual numbers from actual dogs, right? Not like a textbook thing, your personal experience. 2 things that I want to talk about. First, talk about the fact that that number that you're meeting varies annually or regularly and why that is.
Yeah, and so I don't know how often they redo the averages. I don't know if it's an annual thing or they don't think they really address that during your training. But as there's more dogs in the database, the average, of course, is going to change some. When I started doing our wire hairs, the average was 0.39. And now this one that I just printed off is down to 0.37. So there's going to be some variability. But seeing that as 0.37 means we're doing right by Penn hip. Like as a breed, we're making the shift to the left. And so we're doing right. We're starting to understand how to use this, how to continue to improve our dog's hips through using the numbers in Penn Hip.
Okay, so that was one question. Second question, address for us, because I think this is actually really interesting, and I'll give you a background for why I think it. Originally, my family had Clumber Spaniels, right? My best in show dog was OFA Fair. His OFA number in 2000 was 105. Okay.
Yeah.
Clumbers have what we call functionally dysplastic hips.
Yeah.
If the average vet back in the day that looked at these hips would be like, oh dear God, you have to put it to sleep. It's going to be right. And the dog would go out back and the clinic and jump in the back of the pickup, like literally that. So you talked, and I think this is what tweaked me on this. You talked earlier about the muscles holding things together in relation to the distraction index. So breeds like Clumbers, breeds like Spinoni, breeds that just as part of their breed makeup are kind of put together with rubber bands versus breeds like wire hairs or Vizslas or, some of the breeds that are so much tighter knit.
Right.
Talk to us about that, because my anecdotal experience is that those dogs put together with rubber bands that look terrible on an x-ray don't really ever get like what you would think of as classic hip dysplasia, arthritis onset, etc. Talk to me about that, because I think that is super fascinating.
And so I would be interested in those dogs to find out some of the distraction indexes too, because I know there has been a dog that I've done before where I started with the standard extended VD, and I was like, oh, this isn't going to go good in this Penn Hip study. And when the results came back, I was shocked. I mean, that dog still landed in the low risk of osteoarthritis, or mild. Sorry, it was in the mild risk. So it was in that 0.3 to 0.5. When the results came back, I was stunned. Again, why? We aren't supposed to analyze them, because I would have never thought that the distraction index on this dog was as low as what it was. Once they did the math, that subluxation on each step was actually far lower than what you ever would have expected when you looked at it. So when you get down to how many concussive forces are they having with each step, is their distraction index maybe more into that mild risk category? When we think, you look at the x-ray, you're like, man, that doesn't look all that great. Maybe it's better than what we think. Because a lot of these dogs, we don't have
saying anecdotally, yes.
Yeah, exactly.
And I have always attributed it to the musculature, right?
Yeah.
So if you think about, so I go at it from a structure perspective, the broad croup in a Clumber and a Spinoni, for example, right? All that ass muscle, for lack of a better way to say it.
Right, yeah.
Right? That those dogs, I've seen Clumber x-rays that would make your head hurt, and your stomach, like puke. And those dogs are fully functional for their entire lives. They never experience an arthritic problem.
And I've seen the dogs that don't pass OFA do the same exact thing too. Those dogs that when you do the OFA, it's like, well, this dog has hip dysplasia already at 2 years old, and they go on to live in a complete life. And a lot of that gets down to keeping them active, keeping their muscle up, and keeping them moving, keeping that joint fluid, because there's so many other components to the health of a joint. Yes, OFA is looking at the structure, Penn Hip is looking at the laxity, but then there's other things, because there's the muscles, there's the tendons, there's the ligaments, there's the joint fluid. There's a lot of other components to whether or not they are going to exhibit pain.
And I guess I have a particular POV on this, right? Because so many people got really obsessed about having like beautiful hips and Clumbers and lost breed type in the process.
Right.
There is a line, there is a fine line we walk as dog breeders between, we want to have healthy dogs, we want to show that we have healthy dogs, but we want our dogs to actually look like our breed.
Exactly. And that's where the art and science come in is, yeah, it's the art of breeding, but we need to bring in the science too to then continue to improve what we're doing along the way.
So I guess what I would say then for all of our breeds out there that maybe, scare the OFA veterinarians, check out PennHip and
Yeah.
see what you see.
See what you see and see if you can keep moving that graph to the left.
Without
When you have
your breed type.
yeah, but when you have numbers to work with, you can see that difference. And when you see that difference, it's very rewarding.
Awesome. All right, Karen, this is fascinating. I could literally do this for another hour and a half, but I feel like you've had a long day already.
Yeah.
Thank you. I really, really appreciate it. This is a great primer. People with questions, we're going to have some links in the show notes, right, for some of
Yeah,
the
absolutely.
studies that PennHep has done. And so I encourage you guys to check it out. Think of it. Consider another use of science in our art of dog breeding.
Thanks for letting me come on.